believe feeding a temporary home-prepared diet is still a very common recommendation in general practice, especially when feeding dogs. But there are some misconceptions surrounding this practice. First, I would advocate to avoid calling these diets bland, which is quite anthropomorphic, and the components are often quite enjoyed by the pet. But more importantly, blandness doesn't quite explain what you might be trying to achieve with nutritional modification for these patients. The intended rationale for feeding these types of foods is similar to when we ourselves experience acute gastrointestinal symptoms and may have been conventionally recommended to stick to foods like a banana, rice, applesauce, and toast diet, which I believe is no longer recommended in people, given that it is so restrictive. The typical ingredients in these diets for dogs are usually a single carbohydrate source. White rice is probably the most commonly used, and a single protein source. Chicken, like baked or boiled, boneless and skinless breast meat, cottage cheese, boiled or scrambled eggs, or boiled hamburger beef are common sources that I've seen used. I've heard of similar offerings for cats, perhaps relying on a lean fish for protein instead, or even a meat-based commercial baby food. Indeed, what these diets typically have in common is that they are low in fat, usually, low in fiber, and limited in ingredients. These are the features and not so-called blandness, which may confer some benefit to the patient with gastrointestinal signs. The recommendation for food withholding prior to initiating a temporary home-prepared diet, as we discussed earlier, is likely based on the previous belief that the gastrointestinal tract would benefit from rest, but as discussed, there are demonstrable benefits to early enteral nutrition. These diets are typically recommended for short-term use, likely days to a week in most cases. The primary concern is indeed that such diets are not nutritionally complete and balanced and will lead to essential nutrient deficiencies if fed for a sustained period. But one issue with this vague recommendation is that it can be difficult to precisely define the period of time that it is safe to feed a nutritionally unbalanced diet for an individual patient. Feeding an unbalanced diet for 1 to 2 days is not likely to lead to a serious nutrient deficiency, but indeed, there is serious risk associated with feeding for longer periods. These diets are typically lacking in fiber, which may be beneficial for the patient's gut motility or prebiotic effects, some vitamins, certainly minerals, fatty acids, and potentially amino acids, depending on the protein type, quality, and quantity. Other than nutrient balance, such diets are often recommended without an understanding of calorie content per serving and lack precise feeding instructions to ensure that the patient's energy needs are met. And another major concern with these types of recipes is that they can be really inconsistent and unpredictable in their composition with respect to the macronutrient profile. And this is due to ingredient variation or simply vague preparation instructions. As an example, this would be quite relevant for a patient who requires a specific level of dietary fat to manage a gastrointestinal condition. I've definitely seen cases that have inadvertently lost weight or muscle mass due to unintentionally inadequate food intake, but also pets that have been fed their temporary unbalanced diet for far too long a period, maybe as the owner didn't understand that it was actually unsafe to feed that diet for more than a few days. So communication is really key here. In fact, there isn't one single best texture option for all pets. It's going to depend on several factors. Clinicians should be mindful that while a wet and dry formula of a similarly named commercial diet are often compatible and similar in many ways, they may have slight differences that are relevant for an individual pet. For example, a different level of fat or a different ingredient which could be important for a pet with an adverse food reaction. Dry kibble diets may be a more cost-effective or even convenient option when you're feeding a large dog. The pet's preference is very important to factor into the decision. For example, when choosing a diet for a cat that exclusively eats dry food, as well as the owner's feeding preferences. So there are many aspects of a case to consider. So in this case, a board-certified veterinary nutritionist should always be consulted for homemade diet formulation. Although they're not available in every geographic location, there are many nutritionists who conduct remote consultation for home-prepared diet formulation for clients all over the world, in fact.